Thank you. So firstly, I'd like to say good afternoon to all the members as well as the chair, Dr. Pan. So my name is Yitskhaq Abraham. I'm a surgical technologist with Kaiser, West Los Angeles, as well as a Pride SEIU-UHW member. So I'd like to thank you for allowing me to discuss the role of the surgical technologist in the operating room with you today. So I've been practicing for 12 years in different surgical environments across the country as a surgical technologist. We're called scrubs or operating room technicians. We assist in surgeries under the supervision of surgeons and registered nurses. The surgical technologist is in the trenches next to the doctor as their second set of hands during the surgery cases. Before an operation, the surgical technologists help prepare the operating room by setting up the surgical instruments and the equipment and sterile drapes and sterile solutions. We help position patients in the operating table and cover them with sterile surgical drapes. The technologists also assist the surgical team by putting on the sterile gloves and gowns. During surgery, the technologists pass instruments and other sterile supplies to the surgeon as well as their surgical assistants. We hold retractors, we cut sutures, we help count sponges, needles, and supplies and instrumentation. We are responsible for these items not only during surgery, but also making sure that the surgical team has not left any of these items behind after surgery. With the amount of direct patient care that we provide, it is imperative that the technologists be highly skilled and aware of the surgical sterile procedures. Because in the middle of surgery, often we have no time to ask questions. So we have to know our role, and otherwise there can be grave consequences for the patient. In the state of California, it is mandatory for a person who cuts hair to meet a basic education and training requirements. But even though the surgical technologists are vital to the lives of the patient in the operating room, we have no educational training standards in the state of California. I can tell you as a surgical technologist for 12 years that attending an accredited program and maintaining my certifications has made a significant difference in my ability to assist the doctor in providing our patients with a positive outcome after surgery. Thank you for your time, and I'd like to respectfully ask you to vote aye on the Bill 2062.